Yeah, good afternoon, everybody. We're bang on time, so I'll start so I don't get blamed for making everybody late. My name is Carol, and I'm the Programme Chair for the Masters in Child and Family Health and Wellbeing, which is run out of the School of Nursing, Psychotherapy and Community Health here in DCU. And that's the programme I'm going to talk to you about for the next few minutes. Why might you be interested in doing this course? It's for anybody who's particularly interested in the contemporary evidence and issues, in promoting the young person, and the family's health and well-being. So we look at from infancy up to 18, or if you're interested in, critical reflection and analysis to address, current child health and societal challenges that we have in Ireland, as well as internationally, and there are plenty of them. Child poverty probably comes to your mind as one of the first one. To promote and advance interdisciplinary skills. And the program is very interdisciplinary. So it's deliberately set up that way. It's not for one specific discipline. And it's working predominantly to work in collaboration across disciplines in both research, in policy making, we input into policy, and into professional and clinical practices. So if you're interested in any of those three, this course might be of interest to you. So can I go on to the next slide, Martin? Sorry about this. Yeah. Who would benefit from this program? In a nutshell, just about anybody who's working with children and or children and their families. And depending on the professional background you're in, some of you might work more with the children or the young person, or some more with the families, or some with a combination of both. We tend to have students with a background from teachers, so primary school, early years teachers, allied healthcare professionals, so physiotherapists, occupational therapies, nurses, non-governmental organisations, public health nurses, social workers, guards, anybody really working with children. The way the programme is structured, the awards are available. You can have a graduate diploma in Child and Family Health and Wellbeing, which is 60 credits, and then the Masters in Child and Family Health and Wellbeing, which is 90 credits. Okay. So if I could go on to the next slide, please. Okay. The course structured, how the course is structured, it's a blended learning programme. So that's a mix of face-to-face teaching on the DCU campus. It's on the Glasnevin campus, is where the face-to-face classes take part, and online classes. So roughly, and this is very roughly, in year one, it's a 2-year program, part-time. In year one, you tend to do 2 face-to-face days at the beginning and the end of, say, semester 1. So that's 2 days in September and 2 days in November. And then you would do the same in semester 2, but the 2 days would be in January and March. Our students have told us they like one of those days to be a Saturday because you use up less of your annual leave. So we tend to run them maybe Fridays and Saturdays, but we try to get as many Saturdays as we can to save on your annual leave. Then there are online classes which run during semester time only, but not on the weeks that you have your in days, because we don't kill you. So it's 2 evenings a week, and it's from 6 to 8 p.m. Currently, it's on a Tuesday and Thursday. That's what tends to suit the students at the moment. But I mean, we're flexible with those days. Then in year 2, there's 2 days on campus in semester 1, which is from September up to Christmas, really. And that tends to be September and November. Year 2 is lighter in contact hours and effort from you because you have to cover a lot of your modules in year 1. So if I could go on to the next slide, please. I'm sorry, they won't work for me. So what would you cover on this program? You would cover things, the names of the modules up there in year 1 and 2. So if you look at it, like children's rights and participation. So you would look at the United Nations Convention on the Rights of the Child. All policy in Ireland is based on addressing the various articles within the United Nations Convention on the Rights of the Child. Any work that's done with children, these days there has to be participation from children within the service. So I work closely with Barbara Meany in the Department of Children and on participation models on how to engage children and young people within the services and their evaluations, effectiveness, etc. We'd also look at global child health and health inequalities, because an awful lot of the national health inequalities that we have here in Ireland are the same internationally, and what has been done to address these. The contemporary issues in child and adolescent mental health, again, a very popular module. Mental health is a huge issue within childhood and adolescence. So we would start that from infant mental health issues right up to adolescence. And we tend to run parts of that on your face-to-face day because we would get experts in to speak to you, and then we'd also get experts in for other modules like the children's rights. We'd get the Ombudsman for Children's Office in. We'd get Dr. Harry Shire, who wrote up one of the models of participation. Research, you have to do research. So research tends to run throughout the program as well. And that's research and evaluation methods. And that's really in preparation for your dissertation in year 2. And then in year 2, currently we have one module which is it's care closer to home. So that's whether you're from a healthcare background, educational background, whatever the background is, what care services and support from your professional capacity do these children need and receive closer to home? And then you also have your dissertation in year 2. I'll just jump back to year 1 to say that I always allocate a supervisor to the students in the January of year 1, so they can help you with your research proposal and think through the ideas that you want to research for your project. To always pick something that's of interest to you, it's easier to do. So if I could just move on to the next one. So why do this program? Well, I guess you'll be heartbroken to hear that there's absolutely no exams throughout the course. It's all continuous assessment. So that would be assignments, group presentations, debates, posters. There's a variety of assessment methodologies, but no exams. The mix seems to suit people. It definitely does, of the online and the face-to-face teaching. You get very up-to-date evidence-based knowledge, and we would bring in experts within the different fields for the different modules to talk to you. As I said, there's a good mix of teaching methods. Some are straightforward lectures, there's seminars, workshops. So it doesn't matter really what your teaching and style is. One or more of them hopefully will suit you. Students always want the timetable at the beginning of the year because most people doing a part-time master's, you're working full time. So they really appreciate that we make the timetable available in September for the entire year. So you can plan your professional and your personal commitments for the full year. So we give you that in September, and then you can sort out whatever you need to sort out yourselves after that. Students say they like the mix of small and larger groups. So in some of the modules, say the children's rights module, you would just be a master's in child and family students doing that. But if you were doing maybe the global health, that's an option module that other students could join. The research methods module, all the students doing the masters in social inclusion and masters in specialist areas, and this one would be together. So you do get a lot of networking, to make new friends, but within your own field and beyond. And sometimes I think it's that networking and looking at an issue from different perspectives, from different professional perspectives, which is very much enhancing for you. And again, the last one, I guess, is stating the obvious. In so many professional fields today, you need a master's to continue on, promotion, CPD, all of those areas. So it is absolutely been used by our students for their career enhancement to either stay in their area but go for promotion, or to move into a slightly different area that they're particularly interested in. So I think that's the last of my slides there, Martin.